Secretion of potassium in the distal tubule and collecting duct of kidneys depends on intracellular potassium content, unabsorbed sodium load presented to the distal segment, and aldosterone level. Diuretics acting on the ascending limb of loop of Henle are the most efficacious in promoting salt and water excretion because reabsorptive capacity of the segments distal to it is limited. Select the diuretic which is orally active, efficacious in acidosis as well as alkalosis, causes diuresis even in renal failure, and has additional carbonic anhydrase inhibitory action. Furosemide. Furosemide acts by inhibiting the following in the renal tubular cell, that is sodium potassium chloride cotransporter. The following diuretic abolishes the corticomedullary osmotic gradient in the kidney, that is furosemide. Intravenous furosemide promptly mitigates dyspnea in acute left ventricular failure by increasing venous capacitance and reducing cardiac preload. Parenteral furosemide is an alternative diuretic to mannitol in the following condition, that is cerebral edema. Thiazide diuretics and furosemide have directionally opposite effect on the net renal excretion of the following substance, that is calcium. Select the diuretic which is similar in efficacy and pattern of electrolyte excretion to furosemide but is 40 times more potent dose, that is bumetanide. Though ethacrynic acid is also a high-selling diuretic, it is practically not used because it is more ototoxic, it causes diarrhea and gut bleeding, its response increases steeply over a narrow dose range. The sodium chloride symport is the early distal convoluted tubule of the kidney is inhibited by thiazides, metolazone and zipamide. The following diuretic reduces positive free water clearance but does not affect negative free water clearance, that is hydroflumetazide. Choose the correct statement about thiazide diuretics. They induce diuresis in acidosis as well as alkalosis. Thiazide diuretics enhance potassium elimination in urine primarily by increasing the availability of sodium in the distal tubular fluid to exchange with interstitial potassium. The primary site of action of thiazide diuretics is cortical diluting segment. The most important reason for the thiazides being only moderately efficacious diuretics is about 9 by 10th of glomerular filtrate is reabsorbed proximal to their site of action. Individual drugs of thiazide and related class of diuretics differ markedly from each other in the following respect, that is diuretic potency. Combined tablets of thiazide or high-selling diuretics with potassium chloride are not recommended because potassium absorbed while diuresis is occurring is negatively excreted out, and potassium chloride in tablet formulation is likely to cause gut ulceration. Intravenous saline infusion is the treatment of choice for the following complication of vigorous furosemide therapy, that is acute saline depletion. Long-term thiazide therapy can cause hyperglycemia by reducing insulin release. In addition to counteracting potassium loss, triamterene also opposes the following consequences of thiazide therapy, that is magnesium loss. A patient of congestive heart failure was being treated with furosemide and digoxin. He developed a urinary tract infection. Which of the following antimicrobials should be avoided? That is gentamicin. Non-steroidal anti-inflammatory drugs reduce the diuretic action of furosemide by preventing prostaglandin-mediated intrarenal hemodynamic actions. The most appropriate measure to overcome diminished responsiveness to furosemide after its long-term use is addition of a thyroid diuretic. At equinatriuretic doses, which diuretic causes the maximum potassium loss? That is acetazolamide. Which of the following has a self-limiting diuretic? That is acetazolamide. The following is not itself an efficacious diuretic and is used only as an adjunct to other diuretics, that is spironolactone. Spironolactone can be usefully combined with the following diuretics except amiloride. The current therapeutic indication of acetazolamide is glaucoma. A patient of liver cirrhosis with ascites was treated with hydrochlorothiazide 50 mg twice daily. He responded initially, but over a couple of months, the diuretic action gradually diminished and ascites again appeared. So, select the measure to reinduce diuresis. Add spironolactone 50 mg thrice daily. Aldosterone increases sodium reabsorption and potassium excretion in the renal collecting duct by inducing synthesis of sodium potassium ATPase, inducing synthesis of amiloride sensitive sodium channels, and translocating sodium channels from cytosolic site to the luminal membrane. Select the diuretic that can cause gynecomastia, hirsutism, and menstrual disturbance as a side effect on long-term use, that is spironolactone. Amiloride inhibits potassium excretion in the distal tubules and collecting ducts by blocking electrogenic sodium channels. Which of the following is a potassium retaining diuretic? That is tramterine. Tramterine differs from spironolactone in that its potassium retaining action is not dependent on the presence of aldosterone and it acts from the luminal membrane side of the distal tubular cells. Choose the correct statement about amiloride. It can be used to treat lithium-induced diabetes insipidus. Amiloride has the following effect on urinary cation excretion. Decreases both potassium and hydrogen ion excretion. Use of potassium-sparing diuretics in patients receiving the following drug needs close monitoring. Captopril. The following diuretic acts on the luminal membrane of the distal tubule and collecting ducts to inhibit electrogenic sodium reabsorption so that potassium excretion is diminished and bicarbonate excretion is enhanced, that is tramterine. Choose the correct statement about osmotic diuretics. They can lower intraocular pressure. The following is true of mannitol except it is contraindicated in patients with increased intracranial tension. Which of the following peptides is a selective vasopressin V2 receptor agonist? That is desmopressin. The primary mechanism by which antidiuretic hormone reduces urine volume is increased water permeability of collecting duct cells. The vasopressin action mediated by V2 receptor include increased water permeability of collecting duct cells and increased urea permeability of collecting duct cells. Desmopressin is preferred over arginine vasopressin in the treatment of diabetes insipidus for the following reasons except it is a selective vasopressin V1 receptor agonist. Select the action of vasopressin exerted through the V1 subtype receptors. Increase peristalsis of gut. The following tissue is most sensitive to vasopressin, that is renal collecting duct. Desmopressin reduces urine volume in neurogenic diabetes insipidus. Choose the correct statement about terlipressin. It is a prodrug and it is used to control bleeding from esophageal varices. The following is true of desmopressin except it is non-selective V1 and V2 receptor agonist. Indications of desmopressin include the following except nephrogenic diabetes insipidus. Arginine vasopressin is preferred over desmopressin in the following condition, that is bleeding esophageal varices. The following drug reduces urine volume in both pituitary origin as well as renal diabetes insipidus and is orally active. Hydrochlorothiazide.